with y'all. Like, these are not conversations to be having openly in public, and these are not words that you guys should be using. Like,
no,
these are derogatory terms. Like, you're making fun of somebody just by the color of the skin or where they're from. Like, no. Lots of baby boomers with an old ideology and saying things you should not say ever.
At all.
So guys, we are currently on the highway. We are en route to my colo and rectal surgeon's office for a follow-up from surgery.
Show him the baggies. Oh, you can't show him.
Yeah, I have. Jenny's got me this little ostomy thing. So it's like, this is thin, and then there's like nice little thick cushion here. So my bag goes right there, and this doesn't like push too much on my stoma or anything. Because with your stoma, you can't feel anything. So you can inadvertently be causing damage to it, and you have no idea because there's no nerve endings. So you got to be very careful with it. It's very delicate, and you just want to make sure that you take care of it as good as you possibly can.
We're still trying to figure out names for the bag and for the stoma. So if you guys got some names, I was thinking maybe Chip and Dale.
Wow. Okay. Any fun? We want like funny stuff. You know what I mean? So we need a name for the stoma and a name for the bag. Post-op, and I am feeling a million times better. Like, I remember my GI doctor said it to me. My surgeon said it to me. He's like,
"That's crazy.
You are gonna feel so much better after the surgery." And I always thought, I was like, yeah, I guess, like, we'll see, you know. It is 100% true. It is like a night and day difference with my Crohn's disease, which is amazing. Denise is driving up. I am taking advantage of this, of having a chauffeur. It is so nice. It is a night and day difference. I can actually tolerate a lot of foods that I could not tolerate before. Don't get me wrong, I'm not going crazy, but I'm testing the waters and, you know, take a couple bites, let it settle, and things that I used to eat and 4 or 5 bites in 5 minutes, pain, cramping, running to the bathroom, I don't have that anymore. And I've been able to eat, and like it didn't fathom, like it didn't hit me till like a couple days. I was like, wait, I've been eating and I don't have the typical,
oh, my stomach is cramping, it's hurting, and having to go to the bathroom.
I don't have that pain anymore, thankfully. I'm super happy from the surgery. The recovery has
sucked.
Genuinely, it still sucks. I still am in pain and discomfort and stuff, but 100% worth it. I'd do it again if I have to. I'm gonna have to do more surgeries anyways, but so far so good. And we are on our way to the surgeon. We're going to follow up with him. He's going to want to check the stoma, check the incisions, all the sutures, stuff like that. Make sure I'm doing okay. And then from there, we're going to follow up, see when I have to come back again. And from here, we're going to coordinate the care with my GI doctor. The reason why we need to coordinate with my GI doctor is because I still have to do a colonoscopy, and they can actually do it through the stoma. And I was like, really? He's like,
so weird.
Yeah, it's perfectly fine. It's not a big deal, but they need at least 3 months for the stoma and the incision site currently to heal. And then it's safe to actually have the scope go through it. I was like, oh, okay, cool. We're gonna coordinate care. It's been 3.5 weeks. Still gotta wait a little bit, see the surgeon however often he wants to see me. I have to see my GI doctor. And then from there, we're going to watch me and how I feel, how I am, blood work, inflammation levels, and basically monitor me very closely to make sure the Crohn's isn't coming back in another part of my body, another part of my colon, the rectum. The whole goal of this is, with the fecal diversion, allowing my rectum to heal. Allow the fistula to heal 100%, all the fissures to heal 100%, and from there, we can hopefully do the reconnection 6, 7, 8, 9 months down the line, so that I don't have to have the bag forever. And I'll be honest, I would like to not have the bag forever, but if I have to, and I can live this quality of life that I have right now, I have zero problems with it because I feel like I can fight a bear right now. So guys, now we're arriving at the doctor's office, so check in later.
So I am here back in the car. I needed a break from being in that waiting room. We are in the waiting room. An hour has passed by already. There's like still 2 people in front of Paul. When we went inside, there was like maybe like 8 people already in there, which is unusual because this office is never packed. So apparently there was a little bit of a, what's the word?
Scheduling error.
All those 8 people were scheduled for 11 a.m. and they only have 4 treatment rooms. So it's a waiting game right now. So not a big deal. But my biggest problem was I had to get out of that office just because, let's see, how do I word this? Ready for this, guys? I know someone's going to get offended.
Be prepared.
Of course, this is an rectal surgeon. So there's a certain age that majority of the patients are. Because, you usually don't have problems at the age that Paul is having problems. But it's not like it can't happen. I don't like to say, oh, it's so rare for somebody like Paul's age to have this issue. No, because for me, I like to say age is nothing but a number when it comes down to health conditions. Like, I personally don't like to hear,
oh, but you're so young for this.
I feel like that's somewhat diminishing what that person's going through and their condition just because of their age.
Anyway,
I had to get out of there because once again, there are a lot of older patients waiting as well. Not a big deal. And they're all baby boomers. Now, once again, that could be something that offends people. People don't like being called baby boomers. There's nothing wrong with it. Like, I call myself a millennial. It's just the time we were born. And if it offends you the time you were born, you got to take that up with God, not me. Now the problem is the conversation that they're having. Like, they're very loud. They're not quiet. It's a small waiting room. Like, we can hear the conversation. They start talking about politics. I have no problem. Whatever, to each his own. Everybody has their own points of view. Fine. They start going into saying, oh, we got our freedom taken away. Yeah. Oh, I can't believe I can't post whatever I want on Facebook. I've been in Facebook jail so many times. I'm just like, okay. That's a weird way to flex, to brag about something. And it went downhill and they're like, I can't believe we can't say certain words. Yeah. What do I mean? I mean, some of the words that I can remember, that there was a lot of words they were naming off. Some words that I'm like, you want to use that terminology still? Like, what? Like, one of them, Japs. And they're like, I can't believe we can't say that. We can't say spick anymore. And I'm like, I am Hispanic. Yeah, they're like, you can tell I'm Hispanic. Oh, the LGBTQRS community is just so extra. They're the most biggest snowflakes of them all. And I'm like, oh my God. What triggered me is this, like, I can't believe we can't even say the N-word anymore. They said the word. There was no, like, I was just speechless. I was like, I gotta get up and leave. Like, I am going to correct them and put them in their place because this is unacceptable. Like, this is disrespectful. There's certain words that shouldn't even come out of your mouth. I just had to step out and take a breather, and they're still talking. Paul's in there, and some of you guys might be like, why didn't you speak up? Pretty much mainly for Paul. Paul's still recovering, and I don't want him to get stressed out that I am like in a heated conversation, because then he's gonna jump in my defense, and his health comes first. Because right now, any bit of stress, he's in pain and agony from the surgery. So I'm just like, I pick my battles. This is a battle that I was like, this is not something I need to be involved in. So let me ask you, what would you guys have done? There's nothing wrong with the decision you make. You make the decision that's best for you and your personality. Some people are not very combative, so they couldn't handle the situation, so they'll just ignore it. Some people would have laughed it off just because of how uncomfortable they are. And some people like me would have just walked out and like, I'm going to say something. So I'm just here chilling. I gotta go back in just in case Paul got called back, which I highly doubt. It's been now over an hour and 15 minutes waiting, and who knows how much longer we have to wait. I think there's 2-3 more people ahead of us still, so we're gonna probably be here for another hour just in the waiting room. We're finally in the back. How are you feeling?
I'm good. Tired. The nurse, she's super nice. She's
She
making
is.
us laugh and making me in pain from laughing, but we're doing good.
And what did you think of the office or the waiting room
Oh,
conversation?
we're gonna review that in the car as to what's happening, but we're just gonna say this: lots of baby boomers with an old ideology and saying things you should not say ever.
At all. Ever. Even in an office with a bunch of people.
Mm-hmm.
All right, guys. So we're just going to be here waiting for the doctor, and then we're going to talk more in the car. But once again, we're back in the old stone age of an office.
Janice has not seen the new office. I've actually been to their new office, and it's beautiful. Everything is brand new, all super modern and everything, not the big grudge TV in the back.
Seriously.
Alrighty, guys. Again, I have my chauffeur. It's pretty nice. I kind of like being chauffeured around. You know, lean back and let her do everything.
Get me the hat.
The hat and the gloves.
Of course.
Yeah, buddy. Surgeon's appointment went very, very well. The surgeon was great. His nurse, super nice. We always have a good time with her. And everything is looking good. Incisions are looking good. Ooh, beautiful Corvette.
Oh my God.
It's a new Corvette. Shut up. I like it. Incisions look good. Stoma looks good. Everything looks fine. Zero issues there. I'm going to have to follow up with him again in a month. Make sure everything is okay. And then from there, between him and my GI doctor, coordinate care. Make sure that we're all on the same page, which is excellent. Exactly what we need. My appointment was at 11. And I didn't get called back until like 12:40, more or less. So
We're in the waiting room for that long.
an hour and 40 minutes in the waiting room. It was a long time to wait in the waiting room. They double booked it because there's a lot of people scheduled for exactly at 11 when they don't have that many rooms.
So, that was a problem.
The biggest issue was
Oh my God.
I am the youngest person in this office as a patient by about 40 years. Okay, all these people, you know, they're old because you know, it's kind of more typical to have more health issues and later on in life than earlier on. Not a big deal. These people are from another generation. They are baby boomers, and I mean the things that these people were saying. Ignorance. They were, you know, two of them started talking to each other because, you know, the older people, they like talking to each other. And I mean, the things that they were saying, like, oh, this generation nowadays is so soft, everybody's so delicate, you can't say this, you can't say that. And I mean, they started saying some of the most worst derogatory terms you can possibly imagine. Saying, oh, it's horrible that we can't say this word, the N-word.
Guys, so from the recording from when I was sitting in the car to going back into the appointment with Paul, there was another conversation. Then they started talking about, oh, those Jews. I'm like,
Shut up!
What the heck is wrong with y'all?
They started talking about the Jews and the Jewish persecution and all this stuff. I'm just like, what is wrong with y'all? Like, these are not conversations to be having openly in public, and these are not words that you guys should be using. Like, no, these are derogatory terms. Like, you're making fun of somebody just by the color of the skin or where they're from. Like, no. So that was going on. The doctor's nurse, and we tell her, she's like, who was it? Like, who was it? Was it this one or this one? And we're just like, I don't know their names or anything like that. Like, it was just some random old white guy there, you know what I mean? She's like, these old people, they're stuck in their ways and they don't want to change, and their ideology, they don't want to listen, they don't want to hear that what they're doing is wrong and it's not okay. To give you an idea, there was this couple, and you know,
and then the lady, how they were treating her.
Yes, so this lady, you know, she's coming here for the doctor. She had cancer, or she had a cancer scare, or whatever it was. And she is like, I think she said like 13 years older than her husband. But they have known each other for like 30 years. They've been together. So the husband stays in the waiting room, the wife goes into the back, and you know, then the husband goes in the back, and when they come back out, this other gentleman goes, oh, how's your cougar doing?
Oh my God.
Mind
you can
you,
visibly see this lady.
she was uncomfortable. Yeah. And don't get me wrong, they're older people. They're like in their 60s and almost 70s, but that still is not okay to be telling people like, oh, how's your cougar doing? What?
And then he was like trying to bait her into telling her like get the age from her, like how old are you? But he wasn't straight out saying it, treating her as if not even a citizen, not even a person. How dare she have voting rights? That's how they were treating her, like a piece of meat.
Like they were that generation of people. That was slightly unpleasant to have to sit in for an hour and 40 freaking minutes in that office. Overall, everything went great. Doctor was fine. I have a follow-up with him in a month and coordinate for me to do a colonoscopy through my stoma. And he said that I really have to wait 2 months before I can actually start lifting weight, like the baby and stuff. I can help and I can do stuff within reason, but about 2 months until I can actually physically lift anything heavier than 10 pounds. Because, the sutures, like imagine I have a gash in my abdomen with my colon sticking out and they just like sewed it all there. Everything is going well. Babe, do you like changing my bag?
Yeah, sure. I don't care.
This is love.
It's a weird question to ask, honestly.
That is love right there. But guys, that is going to be it for this video. Fun adventure of just following up with the doctors and, making sure everything is okay, which is very important. Just because you're feeling better doesn't mean you don't have to go to the doctor. You need to continue the care and make sure you're gonna stay feeling better and on the right track. So guys, that is gonna be it for today's episode. Please do not forget to like, share, and subscribe. We truly appreciate all the love and support, all the care that you guys say. I see all the comments. I'll get better soon. I hope you're doing well. We truly appreciate it. It lightens our day. It brightens our day up. It makes us feel good that you guys care enough about us to say these words.